Hello, everybody. My name's Martha Lambert, and I work for Ealing Library Service. It's my pleasure to welcome Rudi Page, who's going to do the second in our series of talks, Overcoming Unseen Barriers. Today, we're going to look at health and all the different inequalities that exist, and also what we can do ourselves to overcome these barriers. Rudi has over 40 years experience working in health and across the business world. So be prepared to be challenged, to learn and discover what we can do. So I'm going to pass over to Rudi and first of all, ask him to tell us a little bit about his journey, about how he decided to work in business and what made him feel that he wanted to work in the equalities field.
Thank you very much, Martha, and good evening, everyone. Yes, it's been a long journey. So yes, I call it 40 years in the making, overcoming unseen barriers. So 40 years reflects my business and development as a youngster, starting, first of all, born in London, father from Jamaica, mother from Montserrat. We moved out of London, used to live in Finsbury Park area to Slough. So I see myself very much as a Slough man, as we used to say in the old days. And so I've always lived all around Buckinghamshire, basically grew up there. And so still spent a lot of time in London though. So, so growing up in the 60s, 70s, so I put it in this order: trauma, football, reggae. There would be three key words growing up here in the UK. So the reality of being a child of the Windrush generation, so growing up with prejudice and discrimination, that was just a given. It wasn't illegal in those days. There was no legislation. That's just how it is. So I have been fortunate to be one of those who were able to separate that discrimination, prejudice, separate it from my goals and ambitions and objectives. So I've always been objective driven. So the topic this evening around health equalities for both the workforce and communities is part of the overall picture as somebody that works across many sectors. I was just looking at it today, and I actually work across 10 different sectors, actually, and I have done for quite a few years. But I'm glad we're focusing on health first, just because of the environment that we're in today, which is the post-pandemic era. And so it's going to take a new type of leadership to reduce the inequalities, but that will also be based on what has gone in the past, and we have to provide what we call system thinking. So I'm not a clinician, so I'm a practitioner that thinks about how can we make the system work better. So the areas of discussion today then will be around the communities and also around the workforce and the kind of work that I've done. So by profession then, I'm what's called a policy implementation specialist. So this is in the area of management consultancy. So what we do, people like myself, as a research-based consultant, so we read research reports, look at the recommendations, and then we're able to work out how to actually implement that program. Because delivery is key for changing and transforming people's lives. And I've developed a number of systems over the years that are tailored specifically to the area of activity that I might be involved in. So it's based on a framework. So as a policy implementation consultant, what my approach to the system I've developed is we talk about policies, actions, remedies. So we say read the policies, observe the actions, apply the remedies. So it's very, very clear. It's not by chance how we deliver. So
that's very interesting,
yeah.
Rudi. I just was wondering, during the first lockdown and now, there was a lot of focus on inequalities, especially in the Black, Afro-Caribbean, and Asian communities.
Yeah.
And I was wondering, I mean, obviously from your experience, why do you think these equalities started, and why, more importantly, they continued to the present day?
Yeah, there's some systemic and structural issues that most people don't realize. So if you look at, if you look, right, so when we, in this country, from a policy perspective, we talk about Black, Asian, minority, ethnic. So that's a general term. But you have to look at the population groups. So within that, we would talk about the African Caribbean population group in particular, which we're from. So if you take the NHS and social care in generally, 60% of hands-on care that's delivered is delivered by people from within the African and Caribbean population group in particular. I'm being very specific deliberately. So that's 60%. And then of that 60%, in that all those mixed together communities, 80% actually come from the African Caribbean population group. So you have a high level of frontline staff, and that accounted for much of the transmission. And then, of course, those same people have families. So in those early days, that there wasn't that focus on the transmission from health workers into communities. And then at the same time, the public health messages around communities and hadn't got through yet in terms of not having gatherings and things like that. So, and that hard hit many communities actually, where people were gathered. So it wasn't just people from the African Caribbean population groups. But yeah, it's been at the front line that, and in the early days as well, the personal protection equipment, the frontline workers weren't the priority as well. That was one of the issues as well. So that's kind of the reality that, that different population groups face, and in particular African Caribbean groups.
Do you feel it was something that was systemic then, that it affected the Caribbean and Black communities, particularly when we started looking at the figures and the people that were dying, and everyone could see for themselves? Why was it took that long for management and people to realize this problem?
Well, going back to my point, that's the reality. That is the reality, and it has been the health service. African Caribbean people have been frontline workers since they started to come here in large numbers in the 1960s. That's just the reality. I mean, one of the key things probably for us to think about increasingly is that how can we, in future, do something about taking care of ourselves? Because for many years, there's been myself and others who've actually said that we should be doing more to take care of ourselves within the health system. So not just work in it, but as a community, listen to the public health messages, improve diet, nutrition, and think of, and actually collaborate with each other more. Because we have a lot of clinicians within our community, but lots of doctors. So that's not the issue. So it's not the level of education is not there. So it's what are we going to do in the future, I guess, is the question. So, and we can't just sit back and wait for anybody to deliver us from these challenges. So some of it has to be our responsibility. And with a friend of mine, Richard Davis, we spend a lot of time between March and up to now working on collaborating and working on ways to improve the community information, trying to get radio stations to link up together, trying to get more people to collaborate. So in there has to be some personal and community responsibility towards improving the health inequalities.
Thank you. I noticed in your career that you chose to work with a lot of the major, what we'd call sort of institutions of our society. And I sort of wondered why you felt that you wanted to work perhaps within the sort of mainstream institutions. Is that something that you recognise, or is that something that I just made up?
In fact, I'm glad you actually recognise that, because it's a long time ago. Right, so as a management consultant originally, so when I moved from international marketing into management consulting, I worked in Harlesden Town Centre, and that was regeneration area. And I could see, in terms of impacting communities, where there was a lot of inequalities, it was in how the system was run, how things were organized. And I realized that if you're not organized in a collective manner, and if you just have individuals trying to work on their own, you just don't have a great enough impact. And if you're not around the table where decisions are taken, and if you don't understand what the policies are, if you don't read the policies, you don't interpret them, then you can't make any major impact. So it was around that time that I realized that that was an area that I was interested in. And that was because, having had the background of, we've spoken about this before, working for Dyke and Dryden, which, you know, the largest black company in the 80s. So again, I understood about marketing and systems and being organized and having an impact and influencing the consumer, but you have to do it in a systematic, organized way. And it's something that you have to think about. It doesn't just happen. You have to think, plan, and then implement. So as I move from regeneration, which I think that's the theme of the next talk, so I won't go too much into that. But because I was successful in regeneration, and then I was invited to work with the Royal College of Nursing, and that was about the improving the treatment of Black, Asian and minority staff within the institution itself, in that they should have a greater representative voice, but also how they're treated in the workforce within their employers, primarily NHS trusts. And so again, I realized that the only way that I could really assist is to actually understand how the institution works, how the system works. And then within that, develop programs that enables you to influence change, transformational change. So with the RCN, I ran workshops in London, Newcastle, Glasgow, Belfast, Mid Wales, and then worked very closely with different teams within the workforce itself. Then I realized, working on equalities and reducing inequalities with the workforce, I realized that, again, yes, there are structural issues, and they were there before we arrived, and those structural issues will be there after we're all gone from here. So you then have to say, okay, given that this is the situation that we're in, well, what do we do here? What do we do from here? How do we improve our lives from here? How do we ensure that the community gets the information it needs? And a lot of that is about how we collaborate within ourselves. And there isn't actually anybody stopping us from collaborating with ourselves. It does take a mindset shift, and we have to reduce what I call the self-inflicted wounding, and the rivalry. But we do have a lot of people who do think that way. So there's a lot of collaboration. you know, across our community. It's just that it's not recognized. So the impression is given that we don't collaborate within ourselves, but a lot of things, a lot of work has been done, a lot of health promotion has been done. You know, Bev is online here, Sonia's online as well. I guess you'll hear from them later, but I can give some very specific instances. If you take blood donation within this country, over the last 10 years, there's been quite a lot of us from the Caribbean community promoting blood donation and facilitating and encouraging people to give blood. You might not hear of it. In the media, you'll always hear that the community doesn't give enough blood. And that is true if you think as it relates to people with sickle cell. And it's important that more people within the community do give blood. But for instance, you know, through our collective efforts, there's 4 mobile blood collection units that have been donated through the NHS, facilitated through the diaspora groups, you know, to Antigua and Barbuda, Grenada, Jamaica, St. Lucia. Hundreds of thousands and millions of pounds of medical equipment and accessories and devices has been donated through the community here. And many, many hours of free community development information, advice and guidance about reducing prostate cancer. You know, one of the programs we did, we distributed 17,000 bags of the top 5 cancer information. We ran workshops. British Heart Foundation books on healthy eating, we distributed 15,000 of those books around the country. So a lot of things have been done by the community, and it's important, but you can only do that scale of activity if it's organized in a systematic way, and it can only be done through collaboration.
Okay, I just want to unpack a little bit about what you were saying, because you worked at a very high level, you did a lot of policies. How did you find when you sort of approached some of these organizations? Were they happy to see you? Did you experience racism within some of these organizations yourself when you're trying to implement major policy change? How did you deal with some of the issues you as a you know, somebody working in that field?
Right. Good question. Again, it's down to the mindset. Yes, there's always going to be racism, discrimination. And if you can be humiliated by it and reduced by it, if you're, you know, some people are, but some of us aren't. And I'm one of those people that, because as I mentioned at the beginning, I'm objective driven. So I'm not really concerned what somebody might think about me in terms of their perception of me when they see me. But I know what I'm there to do, and I will get done what I need to do. So sometimes it does work in your favor to be underestimated by people. And that does continue to today. But it happens all over. I mean, one of the approaches I have in terms of a lot of the work that I've done in the NHS has been because there has been complaints about discrimination amongst staff. And then part of my role is to work out what's happened and also make recommendations for transformation and improving the situation. And many times I will turn up and people will say, oh, is it just you? Where's your team, you know? And I just say, yeah, it's just me. But I know it won't be long before they understand it, because I understand how the system works. I'll ensure that there is a systematic approach and the objectives will be achieved. And that's why I've won quite a few awards over the years, or helped facilitate other groups that have won awards as it relates to this area. So it's just being clear and knowing what the policies are and how to implement them from a system. Because an institution is just people. ideas, resources. So there's nothing special. You go into any of the institutions, there's nothing special about them, really. So the thing is, it's not to fear rejection, not to fear being underestimated, but be very clear on what your goals are, the purpose.
Do you feel then that's something that that we all, when I say all, the individuals or organizations or groups, that we all need to learn, is how not to be defeated when we go in, when we're faced perhaps with racism, or we're trying to implement change and people get fed up, and they say, oh, there's no point. How do you get over past that attitude where people say, oh, there's no point in doing it because nothing will change?
Yeah, and that's a good point. And some people do that. And that's why I go back to the point when I said earlier on that there's nothing stopping us from collaborating within ourselves. Because in our community, we have people at all levels who are willing and capable to work out how to get out of a particular crisis. But one of the key things, and we've seen it in the last few months as it relates to COVID, where there's been lots of online meetings, and what's been missing in terms of us not yet seeing a clear plan, particularly from the African Caribbean population group, is because as a group of people, at the end of the day, you have to agree a consensus. It's as simple as that. So if there's a crisis and there's a group of you trying to work out how to get out of that crisis, then you have to reach a consensus and then agree some leadership and management actions that can be translated into workable plans. Now, we have people who are capable of doing that within our community. It's just, again, are we willing to listen to each other and collaborate with each other? There's nothing stopping us at all. And the future meeting, we'll be talking about the Commonwealth and the wider Caribbean diaspora, and you're going to find it's the same thing in terms of dealing with the Caribbean countries and the diaspora. There's actually nothing stopping those countries in the Caribbean, English-speaking Caribbean, what we would call the Commonwealth Caribbean, which is the English-speaking islands plus Belize and Guyana on the mainland. There's nothing stopping them collaborating within themselves and then collaborating with us here who live in the UK. And that's the challenge, that is working out amongst ourselves.
So you feel that there should be perhaps more of a dialogue between ourselves and across the world, talking to countries who have got the same sort of values and attitudes that we have. How would you see that happening? Would that be something
Absolutely. I mean, that's such a good way you put it, Martha, because it's something that we have done. So first of all, when you're trying to work your way out of a crisis, there's a simple line that the first line we use is, all voices must be heard. So not just the people who are the stars or people who've got positions or professor this or doctor that, all voices must be heard. And again, going back to what I said about the mobile blood collection units and the whole medical equipment, one of the reasons that the work that we did around that, there was a link with the Caribbean, and there was a link here, because what we did, we worked with the high commissions to help facilitate the movement of those units and equipment to those countries. But then at the same time, the high commissioners and their staff worked with us to promote the blood donation program here. And also we use the service organizations like Kiwanis is a good example, which has sort of business people and professional people in. So we were able to promote something that the Caribbean needed, and then we had the support from the Caribbean here to promote blood donation. So it has been done, and it can be done. That's one simple example. You're on mute, Martha.
Yes, I've just realised. How do you feel going forward? What do you see would be the future for especially for younger people going into health, into management? How do you feel? What skills will they need, and what is there out there to help them to overcome the barriers?
And that's a good point. The skills that they need. One of the other roles I've had for quite a few years is that I worked with the Appointments Commission for a few years, and that's making senior ministerial and senior appointments. And one of the things that I did notice or have noticed over the years is that we have a lot of people who have the executive skills, but they need the non-executive skills. And one of the best way to gain those non-executive skills is to actually work for charities, smaller charities, help set up community organizations, and then mentor those people. And particularly at the moment, mental health is going to be a major point for us to deal with over the next year or two, next 2 years. And we've yet to really start to deal with that. And that we definitely need new organizations and a new way of working to address the issues relating to mental health. So my advice to young people now, particularly those who've already started a career in health in their early years, would be at the same time, would be to get some experience in working in the community, serving in the community on community organizations, doing health promotions, actually understanding what health policy is, what public health policy is, and how best they can influence their peers in terms of their health, diet and nutrition, because we know at the moment, again, over these next couple of years, that our diet and nutrition is so important, because we're living longer, but what we've noticed, people in our communities with long-term conditions or chronic conditions are starting earlier, and we have multiple conditions as well, starting earlier. So that means that coming up now is a new generation of clinicians who are going to have to deal with this, and we do need, people in our community to be aware of this, and we certainly need to improve the communications as well, because what we've found as well, even now, still here during the COVID time, even though we've got all these multiple platforms, we're still not putting enough information, public health information, into the community spaces with the platforms that we have. So we need to improve that as well, and that's also a good opportunity for young people as well. Get used to communicating valuable information, advice, and guidance to the community as it relates to their health.
Also, just moving on from that, what can we do to dispel the inequalities in the health sector? I mean, you talked earlier on about people being in the lower levels and the lack of PPE in the beginning, and the fact that a lot of people don't get promotions. What do you feel we can do to improve?
Well, some of it is about ourselves. Are you asking me what can we do with ourselves? Because you're on mute.
Sorry, I've been very good about muting. I mean, it's a mixture, really, I suppose, because you sort of spoke a little bit about ourselves and having our own responsibility, but maybe some of it is a little bit higher as well. So I suppose there's that bit at middle management and above. I think a lot of people can manage to get to middle management, but they can't seem to then move forward. So how can we address that inequality?
yeah, to unpack that a bit, because we do have people who are in senior positions in the NHS and other similar institutions. And so it's not as though we don't have any. There is underrepresentation, that's true. But I still go back to the point that we have to find a way to collaborate within ourselves and to care about the inequalities as well. Because sometimes what happens is that people will say, well, I made it into middle, I've made it into senior level, and I'll keep my head down and just get along. And then it's left to the activists who try to just focus on reducing inequality. So there's a high degree of what we're responsible for. And then, yes, there are people who do challenge the inequality within the system. They are there, but I don't think that we should be just leaving it to others when we can take care of ourselves and improve our own lives as well, because we do have the talent within the community to do that.
So, I mean, I can see Sonia's.
Yeah.
Perhaps at the end we'll have some questions. So if you can hold on, Sonia. I just wanted to just think about a little bit more about what you said about people keeping their heads below the parapet.
Yes.
Why do you think that happens if it doesn't happen?
Yeah, there's multiple challenges here within that. So somebody like myself can say this because I work independently. Some of our community who have been able to rise up through the ranks, it's not always a good career move that some people may think if they focus on equalities in particular in the environment that they're in. So it is a challenge, and we had that with some of the responses around COVID, where people who felt they weren't able to speak out because of the position that they held, even though they may have held a position that could have provided more information into the community. So that's why we actually need more community organizations and more people who are willing to share their knowledge with groups so that they don't feel that they're on their own. So people, as they rise up through the ranks, there can be a feeling of isolation because of the lack of representation. So people are very much more guarded in terms of what they may say in public or what they just may pursue. That's just the reality.
Okay, I've got one more question, and then I'll have the floor open for everyone else, so everyone will get a chance to have their say. So really, it's just to say, Rudi, what do you see in 10 years' time? What would you like to see in the health sector? What changes? What would be your ideal? 2030.
2030, which is not that far away, is it? Really, because if we look back, look how quick the last 10 years have gone. So the next 10 years, well, I hope that we will see much more investment from the community in its health, and a greater spread of talent around the various conditions. I think we need more people in the community widening their experience. There's many different careers that they can go into, but in particular, my number one would be mental health. How could we improve in 10 years' time? You know, we do need, I believe we need some real specialist clinics and retreats and well-being organizations focused on mental health and mental well-being, particularly for the African Caribbean population group, given the difficulties they've had over the last 2 generations, and now that we have in terms of mental health. So my priority would be mental health, you know, a real transformation. And love, compassion, and humanity. I think we need those types of institutions as it relates to mental health. So to see them, you know, large specialist units, people who've studied and understand how to improve the mental well-being of people of the African Caribbean population group in this country, and then be able to have better links with the Caribbean itself, because that sense of belonging and heritage and culture is important in the recovery of many people as well. So we need an improvement in pathways between the health system here and in the Caribbean as well.
Thank you, Rudi. Right, I'm going to open the floor now to some questions. So Rudi, I think Sonia wanted to have a question. So if you want to unmute Sonia.
Okay.
Hello, Rudi. Hello, everybody. Thanks very much for that, Rudi. That was very informative, as always. What I wanted to ask, Martha was asking some interesting questions and you were answering them, just talking a lot about systems, which I know is the title of the whole evening. But I want to know, how do you start to build networks?
Yeah.
So what's the process that we can start, maybe a little step at a time, to start to build the networks that we need to support what you are discussing? Because it seems that there isn't, everything seems to be quite fragmented. We know we've got the skill set, we've got the knowledge, we've actually got everything, but we don't appear to have networks.
Yes.
So what would you suggest to start building networks?
Yeah, and that's such a good point, because that's been one of my roles for years, is to facilitate networks. And normally, if I think back to when I've sort of been mentoring students and people as it relates to generating networks, I say, well, what is the issue that you want to resolve? What is the issue that you want to address? So you basically put that, you get a group of people together, particularly if we take mental health as a good example, that we want to reduce mental health inequalities, or, you know, and so it's getting everybody around the table, listening to all voices. And that point I mentioned earlier on is that it's the ability, in the end, the ability to reach a consensus within ourselves on what we believe the strategic priorities should be. And that's the key thing. So going back to the point where I said all voices must be heard, and that's normally because everybody's got their point of view, they've got their concern about the issue that needs to be addressed. So I think that that's what it is, bringing people together, having that dialogue, and dialogue is really important, and listening to all the voices. And the values of respect is really important as well, definitely as part of that. And it can be done. It can be done. And
just moving, going on from what Sonia was saying, do you feel then that maybe communities, as part of what living in a should be setting up networks, meetings to talk about health? Because I think Sonia was saying, well, how do you begin that process of building a network? I mean, someone's got to identify that there's a need for...
Yeah, and normally what happens is that it's a lived experience. Something happens to us, we see something's happened to our family. But touching back on that point, and your other point as well though, Sonia, which you're right, is that there is a level of professionalism that's required to help facilitate that as well. Because a lot of time there's some guidance needed, and there's and just the experience of being able to say to people, look, this is how this particular group will need, this is the environment that this group is going to meet. And if you're going to be a successful network within this particular environment, these are some of the lessons to be learned, what happened to others, but these are also some of the way of working. These are some of the obstacles you're going to face. And here are some people that if you listen to their insight, that will actually help you along the way. So there's some facilitation going on there. There's also some mentoring, and there's some coaching as well. That is really important. Going back to your point in terms of networks, because the way things are now, unless you're really clear what your purpose is and you understand what the policies are, you're not going to get anywhere in the end. And especially if you again haven't agreed amongst yourselves with clarity what the purpose is, what's the strategic objectives, what are the actions that are going to be taken. Is everybody keeping to their word, turning up to the meetings? Are they doing the things that they promised to do? Are they listening to each other? Are they accepting collective responsibility? So we may disagree, but once we reach a consensus, we get on with it. We don't keep talking about, I didn't really want to do it. It's that kind of self-discipline, self and community discipline, because other population groups are doing it without making any false comparisons. And we live in a competitive world.
Yeah.
And that's the thing. And of course, as we know, particularly in the experience of the last two generations for Caribbean people, because of the level of integration, so some people, they will say, well, I'm okay, I don't need to get involved in anything like that until something happens to them. And then they're then looking for support within the community and wonder where it is. So again, it's how can we encourage our talented individuals to work within the community as well and share their knowledge and insight, because they've received the training. Many have received the training from public institutions within this country.
Yeah.
As well. And that's part of the conundrum that we face in terms of, especially at that local neighborhood level as well.
That's just one other thing, Martha, I just wanted to ask you. So based on everything you've just said, how do we ensure we have succession planning?
Absolutely.
Because you've talked about previous generations, and a lot of us, we are of the age, my parents, I would say, from Windrush and from West Africa, came here in the 50s and the 60s. So they did have networks in place that, when I say networks, they were the workable networks. You knew where to go, especially around health, to be honest, you really did. So I'm just wondering how then we're building the networks and the structures, but how do we get a succession plan? Because to me, it seems that we always seem to be coming from the same base again, but we do know that whatever it was has happened prior, because we all can relate to somebody, we know it's there, but there doesn't seem to be the succession planning. I would really be interested to find out how I could start to, doing things that I know how we could put that in place, just engaging our elders, all this valuable knowledge.
Yeah, you raise a good point there, Sonia. And in terms of community development, our generation now we're probably the first to really think about succession planning in this way, because our parents' generation, Windrush generation, because of the hostile, harsh situation that they found themselves in, yes, they were close, they worked together, but that whole idea of passing the baton on to our generation, that was a big issue for that generation. And in fact, what we found with a lot of the organizations, they kept going much too long. So when our generation came along now, we didn't inherit the structures and the systems and the buildings and the community assets that we probably should have. But our generation do understand that we have to train young people. And that's why in one of the other areas of work I'm involved in with Derek Clement, that we started the hair care and barbering skills clubs, because the only way that you can succession plan is build the skills of the next generation and allow them to lead, And I've yet to hear of, and I'd like to be proved wrong, that we have developed community organizations now, or we're developing them and saying to young people, maybe in their 20s, right, you lead on that now. This is being handed to you. If you need assistance, come and let me know. And I'm hoping our generation have learned from what happened to us with the generation before us.
I think also partly is the people understanding the way that health works and the language of health.
Yeah.
And how, because I think a lot of people like education, they get scared, you know, if a health professional or a doctor says something, then they don't know how to deal with it. So do you feel it's that sort of language as well that puts people off, that they think, oh, I don't understand, or I won't be able to, the writing, the documents that you have to write to get grants, it's all too much for some people?
No, not at all, because we have a lot of people in our communities who are grant writers, put bids in all the time, raise hundreds of thousands of pounds. They exist within our community. And going back to Sonia's point, in that we do have to think about succession planning. That's a good thing. And maybe it's something we should prioritize, session planning, in terms of, as we're focusing on the future, really make a decision that actually we need to get some young people, those who've got the right attitude, they've got the aspiration, they're willing to work hard to attain their goals, and give them an opportunity. So in answer to your question, Sonia, it's about opportunity and just allowing that next generation and making a hard, conscious decision to say, yes, a young person must lead. And that's why I believe in mentoring, because I'm one of those who benefited from myself without going back into the Dyke and Dryden world, 21, being given the opportunity to be in charge or coordinate a major exhibition. So it's that opportunity. It's what can we do? And it is challenging times, but also it's about, are there any young people coming through that we see that are showing that initiative? They've got the attitude, they're motivated, even though the circumstance may be difficult. And maybe they're the ones that we should be trying to identify and support. So there's potential there for us to do something about it in terms of that succession planning. Thank you.
Are there any other questions? Would anyone like to just say something? Beverly, would you like to say something?
Yeah, it's not a question as such. It's just going back to when Rudi first started to speak about the 60s and being Windrush parents and the children. I'm from that era as well, and I was brought up in Rugby, it's a small town which is mostly white. It was about 2 or 3 black families and 1 or 2 Asian at the time. And there was a very close community there. And we found that in school, we stuck together. And yes, we were called names and stuff like that. But we didn't go and sit in a corner and cry when we were called names.
Yeah.
We would find the name to match the ones that is suited to them as well.
Yeah.
That's what we would do. Yeah. And because of that, everybody, parents, grew to know each other. We educated. We were brought up knowing how to defend ourselves in that type of environment.
Yes.
Coming from, because as Rugby it's still very much that type of place.
Yeah.
And so for me, I started off as a cadet nurse.
Yes.
Yeah. And I moved on after marriage and having my kids, going back to nursing. And it was a struggle with me having 3 kids and going back to nursing. You couldn't get them taking you back if you were black and you were married and had children.
Yeah.
I was lucky. I applied to loads and loads of hospitals, but because I was black and had children, they wouldn't entertain me.
Yeah.
One hospital took me, and it was St. James's Hospital in Balham. Yeah. So from there, I moved on. But the level in which they had nurses coming in, even into this country to be RGN, which at the time there were registered nurses, general nurses. You found that they were coerced into saying, no, you will start at this level, which is EN, enrolled nursing.
Yeah, the SENs,
That's right, which was the next level, like the auxiliary.
Yeah.
And a lot of nurses took it on the chin.
Yeah.
because they wanted to stay in a job and they wanted to have a career.
Yes.
It was very hard, and it still is this day, because you will find it's a very hard struggle, as Rudi has mentioned, that to rise to the top as a black person, in the health service system, you have to be how many times better, or you have to be canoodling or be friends of that one or whatever to get there. And when we do get there, we don't help our own. We don't. Rudi, I know for one person that I know, is trying to educate through the RC, and he's had sessions, he's had lectures, which I've attended, outside with other hospitals, sending groups inside London to try and educate them and get them to look at themselves and being better persons to rise up the ladder in nursing. And it's still happening this day. I struggled to get where I had to. I didn't get to management level in my career, but it's, as Rudi know, it's not that I didn't fight for it, but the lesser person who was white, I was delivering the work, I was teaching, I was mentoring students from City University, getting dyslexic students through their education to become qualified nurses. Yeah. But I never still, and because of that, I said, no, enough is enough. I retired a bit earlier than I wanted to.
Yeah.
It's still a hard struggle today. Yeah. And trying to unite as a group. The only way forward is that we don't just look at ourselves as individuals, because a lot of us, I'm black, and I know a lot of us look at ourselves as individuals, say, oh, I'm all right, Jack. Yeah. They don't seek to educate and help each other and pointing them in the right direction. You do it, and you are the bad man by either your own or the white person. And that's the things we've got to have: eyes in our head, ears at the back of our head. Don't speak, just learn how to act, you know, to save ourselves from these things happening in order to move on with our lives. Yeah. There's a lot more I could say, but leave it. Rudi knows.
Yeah. Yeah, Bev. And I understand that there's many people from our community who didn't realize their potential within the system. But then though, Bev, when you look at the work that you've done voluntary through the Kiwanis and other community organizations, it has contributed to the better well-being of the community. But it's a sacrifice that we, you know, some of us make, some of us don't, and that's.
But we do try. Yeah. Imagine how many of us is in this country as Afro-Caribbean or Asian, and it's about 4% that donates blood. But when we get sick with sickle cell, when we get stabs in the maternity section, labor, giving birth, bam, white women are more susceptible to bleeding to get a blood transfusion. But yet still, we went out campaigning for years. Since 2015, Rudi launched the blood thing with NHSBT. We worked closely with them. We were getting somewhere. We had to literally beg people to sign up to donate, right? But yet still, when we get sick, we go there. And it's a shame, because our blood, the person that found out that our blood were totally different. It's red in color, but the nutrients in it, it's totally different to the European. It was Dr. Dapo. Yeah, when he brought it to us, Rudi brought him along, found him, took it up. We took it on board. We did a lot of work, but try and get the community to work with us on this. It was a big job. We went and in Leaf Cesar, they weren't interested. We were all over the place. Rudi had presentations at supermarkets, had people do lots of stuff. Lots of stuff was done. They weren't interested. But we did fight, and it's still ongoing.
Yeah.
You know?
And we haven't given up.
No, we haven't given up on it.
Beverly, it sounds, it's frustrating that you're saying that it's still a problem today. And do you think it's a cultural thing? Is there some reason why? Is it because we've just not been brought up to think about giving blood and donating in the same way?
Well, some of it is to do.
Can I answer? Okay.
Yeah. Okay. I'll let you answer. Go on then.
Some of it is to do with religion. Yeah. And in the Asian community, it was a very hard struggle to have that breakthrough with them to donate blood, because you'd find that their children or their younger people would want to donate blood, but they would have to hide to go and do it, yeah, without the parents knowing or any member of the family knowing. Then it came to it where you had to be able to get someone to negotiate with the rabbi or whoever he was for their what do you call them, their temple or their synagogue or what. You'd have to get someone who knows him, the head one, to talk to him, to get in there and try and educate them, communicate with them and educate them. But they were one of the first people in hospital, if they need an organ or blood, they demand it. They didn't think that, they didn't sort of encourage their people to donate. They demand it. And I know from experience that's the case in my job that I had. Yeah, this is it. So we need to get it out there more, that it's not just, we can't just keep taking the white man blood. When a child of sickle cell gets 2 units of your blood, he or she has to get 4 units of the white man blood. Yeah, and her immune system lasts longer. And we've just got,
one of the key public health messages around that is that it's better, all the evidence that is that it's better to get blood from somebody from your own ethnic group, basically. So that's why there's this continued promotion to encourage more people from African Caribbean communities, because it is a challenge anyway, because I think it's only about 3% of the whole population anyway in this country donate blood. And so when you then break it down to the population groups, they say when it comes to African Caribbean in particular and Asian groups, it's 1%. I mean, we don't really know, but that's the figure that's bandied about. So it's a difficult area anyway. And then yes, there's cultural reasons, there's suspicion, there's myths, there's the experience in terms of what people have faced within the health system, in terms of families, relatives, when they, so it is a challenge. There's a lot of barriers, but again, as we said earlier on, but you can't give up, because the best thing for African Caribbean people in the hospitals, having operations, having babies, the sicklers who need blood all the time, is to have blood from their peer group. And there's a lot of activity around that as well. And that they feel like a neglected group from within the community as well. But
and also our population overall, with immigration or migration or whatever, it's like 4 folds now to the 60s, when you had loads of doctors, loads of hospitals. So you didn't have many black families being assigned to one surgery. So you used to get the attention more than you used. As a patient, you were treated well. Yeah, but in this day and age, that we are using up resources that some of them might find that we won't give them the best. I know, but we won't give them the best, but we'll give them. But eventually, if you've got a member of your family or a friend who has knowledge, someone like Rudi or myself, who will go and say, look, that's my uncle, this is what's what, they soon change their tune. This is what I'm finding is happening. Yeah, it does happen, and that's something we've got to look out and listen for.
Yes, that's the whole program.
Equality.
Yeah, that's a whole that's another program on its own, and we've come to the end for this week.
Yeah, it's a lot. Yeah. It's a big subject.
Yeah. Okay, so Martha, we've come to the end of this program.
Well, thank you very much, everybody. Thank you for that. Those interesting questions, and I said, at the beginning that it would be a chance for us to be challenged, to learn and discover. And I think, Rudi, you delivered on all those things. It's a difficult subject. It's a challenging subject. Yeah. So I think it's something that now is challenging all of us in our families, in our work, wherever we are, to begin the debate, because as you said, it's not just the health of people, it's everyone that needs to be involved.
Absolutely. And COVID has uncovered that fragmentation, that lack of communication across the community. And people are already saying, get ready for the next pandemic. People who in the know are saying, get ready, so that means we should be thinking and planning, what are we going to do? We don't want to wait till the day before. But on a positive note, next week's topic, same time, Wednesday, the 11th of November, 6:30, we'll be talking about community economic development. So community economic development, which I know that's a subject close to Sonia's heart. So I expect to see Sonia on that one next week. And of course, as we've seen again in this pandemic, the community economic well-being is essential because of our mental health. So many of our businesses have been devastated, going down to zero almost, many of our businesses. So we've now got to think in this digital age, how are we now going to transfer our talent, knowledge, talent, skills, and insight into the digital space? Then having done that, translate that into economic value that will contribute to our mental and economic well-being. That is a high mountain that we are now having to climb. And again, the structures and systems are not there really within our community in this modern age. And we have to think about how we're going to develop alliances, networks, partnerships, how we're going to collaborate with ourselves, how we're going to work internationally and across many sectors. So that's the conundrum that we'll be talking about next week. But we'll also be looking back at what was done, 30, 40 years ago, because there, again, as I said at the very beginning, our community has lived in a crisis and always found a way out with creativity, communication, skills, collaboration, all those things, the partner system, So we do come up with ideas. So next week, Martha, we'll be thinking about that. So I look forward to some challenging questions from you on that subject next week. And obviously within there is education. And we've been talking about the 21st century skills, lifelong 21st century skills. How are we going to acquire these new skills? Sonia's research has identified many women in our community between 40 and 60 years old now. That's a major priority group. How can they generate an income? Because, life goes on. They may have worked most of their life, brought up children. They may have been, on their own or marriage breakup or whatever, but they still have to survive. So how are they going to survive in this new era? What are our young people going to do? Where are they going to go to get skills? The young people coming out of school now who maybe in the last year or two have not had any schooling. So think of next year. Think of the cohort. Imagine if you've got a child at 14 years old now and is leaving school in 18 months' time, 16 years old. How much education have they really would have had in those last 2 critical years? Where are they going to get a job? What skills are they going to have? So what does that mean for the community? All those things that we have to think about in terms of community development, community economic well-being, the mental well-being of the community, all these things that we need to have some plan for.
Some really interesting questions there, and I'm looking forward to the discussion next week. So Sonia, I'm expecting to see you there next week, and thank you, Rudi, again for bringing your experience.
Sonia, you're on mute. Sorry to talk over you, Martha.
Okay.
Sonia,
did you want to speak?
Yeah, let Sonia speak and then you close. So,
no. I was just saying thank you, everybody, Martha and Rudi and Beverly and everybody else. It's been really exciting. Thank you.
All right. So you take up the challenge for next week?
Yes, I will.
Excellent. Sorry, Martha.
I think on that note, I just want to say thank you again to everybody, to you, Rudi, and we'll take up the challenge for next week, Wednesday at
Great.
6:30.
See you, Bev, and thank you. Bennett is in Montserrat. So Bennett, if you Google the Montserrat Reporter, Bennett is the publisher of that. So thank you very much. And the weather looks very nice out there, looking through the window. I can see the volcano from here.
Take care then. Bye-bye.
Bye. Bye.